Buckelew was chosen to be one of the 12 call centers to implement 988 in 2022 in amazing collective efforts at the state level to be able to have a resource available 24/7 to any caller that has access to that 3-digit number. Buckelew had always been a provider for suicide prevention, and it was a very easy choice for us to jump on the wagon to implement 988.
So a lot of times it's just being heard, being seen for who you are, and understand that as a human being, we all go through levels of crisis. Suicide cuts across all socioeconomic, ethnic, and other classes. It affects all of us. What we know from supporting individuals with mental health and substance use challenges is that once you get engaged in a system, if you have to jump from provider to provider to provider, the likelihood of continuing that engagement drops off. The benefit of Buckelew Programs, in my opinion, is that we have a continuum.
When you call 988, you are connected with your local community. So for here, it'll be Buckelew Programs. You'll be connected with a local trained counselor or volunteer who will be there for you, listen to you, and also provide you with local resources if that is something you're interested in as a caller.
So when you dial 988, there's a couple options it walks you through. There's a veteran service option, if there's a LGBTQIA plus service, and then if you stay on the line, you can just speak with a counselor. There's also a Spanish speaking option as well. Yeah, counselors are trained in harboring that safe and welcoming space for a caller so they feel heard and validated. We risk assess and safety plan because our goal is to make sure the caller's safe, and we want them to feel validated and heard, and we do that with empathy and compassion.
So I'm very proud of the fact that Buckelew can resolve crisis on the phone. About 99.7% of our calls get resolved right then and there. But what's really important to know is that many people in our community, many organizations can connect people and keep them out of higher levels of care, like hospitals, emergency rooms. And how this impacts our broader healthcare system is it moves it out of a system where people are treated as a diagnosis to people are treated as a human, as a person who hears the human struggle that's going on, and they can help translate that into what would best support the individual.
I think it's getting more normalized to call, 988, just as it would be normal to call 911, another 3-digit number.
It's important to raise awareness for 988 because it literally can save lives. Every time we spread the word of what it is and what it can do, that is one less person that loses their life to suicide. One less person that has to struggle alone in the middle of a crisis, and that is one more person that has access to care. 988 is meant to be a crisis lifeline, and it is also meant to be a resource.
Taking calls made me realize that a lot of people do hurt. Maybe they hurt in silence, maybe they don't want to talk about it, but the ones that do call, they're open to talking about it. I think that's so brave and strong for someone to be able to call in and talk about how they're really feeling.
Having that number to reach out and connect with someone immediately can absolutely be life-saving.